Welcome to the Healing Pain Podcast with Dr. Joe Tatta. Each week, we interview top experts in physical therapy, pain science, and integrative pain care. You'll learn the most up-to-date information for treating and reversing persistent pain. This podcast is for educational purposes only and not intended to be used as personalized medical advice. And now, here's your host, Dr. Joe Tatta.
Hey there, welcome to this week's episode of the Healing Pain Podcast. I am your host, Dr. Joe Tatta. Each year in the month of June, I record one key episode related to LGBT health equity and highlight the work of one guest or one speaker who's doing important work in this area. So to begin today's episode, I'd like to share 7 stats related to LGBT health equity and why the work of today's guest is important. Okay, here goes. More than 50% of LGBT people experience some form of healthcare discrimination. 1 in 5 transgender people has been denied health coverage simply because of their trans status. LGBT people of color are more than twice as likely to avoid the doctor's office than white LGBT individuals. 75% of lesbians report delaying or avoiding healthcare. A 2015 study reported 80% of first-year medical students expressed implicit bias against gay and lesbian people, and 50% expressed explicit bias. LGBT youth are 5 times as likely to have attempted suicide compared to heterosexual youth. And number 7, this year marks the highest number of LGBT anti-transgender bills in the history of the United States. So far, over 90 anti-transgender bills have been introduced in the 2021 state legislative session. Now, the concept of health equity simply means that everyone has a fair opportunity to be as healthy as possible. As you reflect back on those 7 stats, I ask you as a healthcare practitioner, does the LGBT community have this fair opportunity? And are we doing enough to support this community, not only in pain care, but in the promotion of overall health and well-being? My guest today is Dr. Karla Bell. Karla is an associate professor of physical therapy and co-director of clinical education at Thomas Jefferson University. Dr. Bell serves as co-chair of the PT Proud Committee through the Health Policy Administration of the American Physical Therapy Association and is the recipient of their 2021 Public Policy Maker Award. Dr. Bell is pursuing her PhD in public health sciences with a focus on LGBT health equity and is currently a part of 3 active educational research projects around sexual and gender minority education and the patient experience. Today's episode is about how we can promote LGBT health equity and well-being. This episode has applications for both physical health as well as mental health professionals. Okay, without further ado, let's begin and let's meet Dr. Karla Bell. Hey there, Karla. Welcome to the Healing Pain Podcast. It's great to have you here.
Nice to be here. Nice to see you.
Happy Pride.
Happy Pride.
It's June. Every year I do at least one episode on LGBTQ plus topics. They're important just in the greater context of society. Of course, they have so many intricate connections to health, right?
Absolutely.
Both physical and mental health. And as PTs, this is everything what we're talking about nowadays. I think a small detail people don't know about you is, well, they know some of it from your bio that I read, but you're a full-time professor at Thomas Jefferson University in the DPT program there.
I am.
Training lots of great new DPTs. Hello, DPTs from Thomas Jefferson. And you're also finishing up your PhD in population health. And you kind of have a focus on some of this LGBTQ information in there.
Yeah.
Talk to us about that and why, population health is a big topic and how you whittled it down into that important topic.
Yeah, sure. Well, I really have been kicking around pursuing my PhD, but more of the traditional senses of PhDs in physical therapy didn't necessarily completely jive with my interest areas and passion. And when I moved to Jefferson 3.5 years ago, I was already in this research area with Melissa Hoffman, who's a co-PI, who's the principal investigator of one of the research studies we'll talk about a little bit later. And I just realized that their population health program kind of jived much better with the direction I was going into and in sexual and gender minority health, and really around the areas of intentionality in how we as healthcare providers and educators, our behaviors and how they shape the healthcare experiences of these populations, right? And so I'm actually on the health behavior track in population health, and I'm really, really interested in education as an intervention to shape behavior to have an impact on healthcare disparities. So, yeah.
Interesting. So when you say education as intervention, that's from the university side or from the public health side, or both?
Really both, but right now, one of the research studies that I'm doing is around a faculty development program, and that's looking at education and training as an intervention to faculty to then improve the way they educate and the way they practice in the clinic to make the healthcare experiences of these communities better.
Yeah. Talk to us about equity for this community and what that means, what's potentially missing, what people don't realize.
Yeah, absolutely. Well, currently, probably many folks may not know this, but 2021 in the United States is actually the worst year on record for anti-LGBTQ plus legislation in our country. And, this is a milestone that honestly, I didn't think we would ever hit. It is 2021, and we were going in a very positive direction for equity for our communities and populations. And so far, I think there are 18 anti-LGBTQ laws that have been enacted into law this year. And that's more than the last 3 years combined. And we're not even halfway through the year yet. Many are still pending, many are still in process. There's a combined over 275 bills across the country in some form. So why the focus on LGBTQ plus equity in the US? Well, here it is, right? These populations already have staggering health care and health disparities that exist, and research on physical activity, we in our profession focus on movement, physical activity, those kinds of things. Well, research for these populations in that area and disparities is very limited. But we do know some sub-communities have worse physical activity outcomes than non-LGBTQ plus communities. And these social determinants, when we're talking about current state day in our country right now, these social determinants of health, the focus on legal rights specifically, are really critical for healthcare providers to understand for these communities, and these anti-bills push the care and equity of these populations further in the wrong direction. So that's why the focus on this, specifically, obviously, with the legislative part of the social determinants of health weighing heavily at the top.
It's so interesting because we went from marriage equality being such a big win and a big celebration,
Yeah.
and things were just like steamrolling in one direction. I think the past administration may have changed some things.
Yeah, definitely.
And so social determinants of health, I like talking about more and more because it helps give people a bigger picture than just the individual. Like obviously as therapists, we're very focused on the individual who comes into our practice. We evaluate them, we treat them. We're moving toward like individualized, personalized care. And then there are all these other factors that are happening on the outside that you might not see and how they impact community, specifically, obviously LGBTQ in this community, in this sense. What does a physical therapist need to know with regard to those social determinants? And when they're, treating a patient, reaching out to people in their community, what should they be aware of?
Yeah, I mean, so as I mentioned, the legal parts of the social determinants of health, but they're really critical, right? So 80% of someone's health status is directly correlated to these social determinants of health. And so like economic quality, stability, neighborhood and built environment, education, access and quality, healthcare and access and quality, all of that stuff is considered the social determinants of health, right? And that means when, populations don't have equal legal rights like these populations, everything else dominoes into those social determinants of health, right? They're impacted. Their economic stability is impacted. Their access to stable environments, protections, public social stigma attached to these. And that's the other thing that's important to note is for us to truly understand the experiences of these communities when they're seeking our health. And some of them are even afraid to seek our health, even seek physical therapy because of fear of discrimination or fear of feeling like they're going to be comfortable in your clinic. Do you have all gender bathrooms? Or do you only have binary bathrooms? Are there places where they can feel comfortable changing? All of that stuff really comes into play, right? And so, the stigma that's associated with these populations when we're legislating and politicizing their lives every day in the media around these bills, that impact's really hard to measure, but it has a very real impact on people's health and well-being. And so, people think that there's something wrong because now we're having bills and laws explicitly excluding some people from something, and that has a measurable impact on quality of life, right? So the fact that there are now, and some of this is just raising awareness of physical therapists. So many physical therapists don't even know that this is going on in our country, right? And so the fact that there are laws now dictating where someone who is transgender can go to the bathroom or access public places. So Tennessee just passed a bill where if you're a business, you have to actually alert everybody that you will serve transgender people. That's in the United States. And so again, this is incredible harm to one's sense of self, one's sense of mental health, one's quality of life and well-being, to say a few things, right? And so we as physical therapists, through our behavior and how we clue in people to our inclusivity and welcoming environments really matters to these populations. And so those are through our inclusive practices, our knowledge base, how we engage with folks and respect their families and their pronouns and who they are. And, through all of that knowledge and training can signal to a person that, all right, I'll come back to this place and get the care that I need, or I'm not going back to that place. And guess what? Now their physical activity goes down. The reason why they came to see you, they're not going to get treated for, something else is going to happen. We all know the sequela from that happens. So there's lots of reasons that we need to know this as physical therapists.
I want to talk to you about some of your research. I know it's not published yet, but there are some themes that you can talk to us about in a couple of papers that you have coming out. And then I want to talk about our profession, which is a bigger topic. But let's talk about your research first. I know you have a couple of papers. Share some of the themes that you're seeing develop in that research.
Yeah, so the first research study that I'm part of with Melissa Hoffman, who's co-chair of PT Proud with me, and a bunch of other folks, Chris Condren and some other folks from Regis University. We're looking at the barriers in physical therapy for sexual and gender minority communities. And it's a staged research project. We did over 100 focus groups for clinicians to look at perspectives from their perspectives in treating with these communities. And that is the paper that is going to be in draft and coming out. That's the first stage. And we're looking, the thematic analysis from that really showed, some highlights of really almost a complete gap in education, in our DPT education, in our PTA education, for future providers coming out in this area, and basically saying they really didn't know anything about these communities. And so therefore, if they were contributing unintentionally to disparities by, disrespecting or not being inclusive in any way, that was a big theme. And
so I just want to just pause there. So you interviewed physical therapists about their knowledge base around LGBTQ plus communities and how they interface with them.
Yes. So our focus group questions were around what they were aware of about these communities, how comfortable did they feel treating these communities, a bunch of focused questions around those kinds of themes of questions. Yes.
And did those questions focus on what they learned in school as well, or was there knowledge present in school?
Yeah, so our questions focused around not just what they learned in their education as getting to be PTs, but also in their continuing education. Right. And so, or their employer education, or whatever happens since they've been in school. So, and what we're finding is it's not just a gap in professional education, entry-level education, but it's a gap in continuing education as well. Yeah.
So there's limited knowledge there for physical therapists entering into the field to take care of these populations in an equitable way.
Correct. Mm-hmm. Correct. So that was one, and two is really interesting. Some themes coming out about trying to voice how this belongs in our profession, in what categories, and some folks thinking it's a political discussion versus a health discussion. And so again, it's around some of the politicization of these communities that unfortunately negates the real impact on their lives of things going on, right? And then other things that came up is around PT's role as teacher in the clinic to other students, to working with students who belong to these communities. Also, lack of awareness of current day legal status of these communities. So not just unique needs of health, and just a global lack of understanding of terminology for these communities. What goes into the quality of life? What does quality of life mean for these communities? What are the considerations there? Even the social determinants of health, not realizing the staggering disparities that exist in economic stability, even food insecurity in some regions for these communities, mm-hmm. all kinds of things. Yeah.
And then how does that start to, you've already done a lot of work speaking at a national level and a state level, even before your research has come out. I mean, you're sharing this on social all the time. You're speaking at CSM, you're speaking at state conferences. What type of information are you sharing, and what's the feedback and the questions that our professional or colleagues are asking you?
Yeah, so that's a great question. That leads me into the second research study that I'm actually involved in is around, so I'm part of a interdisciplinary educational research team at Jefferson, with 3 OT colleagues and myself. We've created a 7-month-long comprehensive sexual and gender minority education and training faculty clinician development program, mm-hmm. That is just completed its second year. And we're hoping to actually publish now findings. Our first year was a pilot, and we got funded, and it expanded, and we had about, I want to say 40 participants this past year from across the enterprise of Jefferson. And so we had physicians, we had nurses, we had physical therapists, occupational therapists, athletic training, but also not just healthcare providers. We also had architecture, we had fashion design, because our campuses are meshed. And what we found out with that development program, because the goals of that educational research, and we do pre-post data collection on validated surveys around this content, is we're finding out that, folks are thirsty for this information, and it's really structured around inclusive practices. It's really structured around social determinants of health, and also student success, and then also patient success when they're trying to engage into the healthcare system, right? And so what we're finding out is people are really seeking out this information because nobody's had it. So we have physicians who've been practicing for 30 years in this program going, this is amazing, because I wish everybody had this information. And so, what we're finding, again, to reiterate, folks are asking for, one, basics 101 about terminology and being able to respectfully engage and understand when certain terms are used with these populations, what they actually mean to these populations. Two, how to engage in inclusive practices and set up a warm and an environment that when somebody from our communities walks in, we know it's going to be an okay experience, and we can just let our guard down a little bit and be ourselves and share what we need to share about our health status so we can get the best care that we need and not hide anything. And that oftentimes happens with our communities. There's lots of information left out, either from social support or all kinds of other questions that go along with what you need to share with your healthcare provider. Your sex life, really important things that if we don't share, then we don't get the care that we need, right? And so, those kinds of things, but also it's an opportunity. What folks are finding in this education and training program is that they're able to process and they're able to strategize on things that are coming up already. So they're talking about, students that they're working with that they don't know how to troubleshoot and come up with the best way for that student to be successful. And it is because of these identities. Somebody comes in and shares that their parents kicked them out of their house. And they don't want to be the faculty member who sits there with their jaw open. They want to be responsive in a sensitive way and be able to offer them resources that they need. And so again, or the patient who also shares that they just lost, their job because of their identity. And, all of those things that are very real realities for patients and people every day in this country. Yeah.
Do you find when people learn about the information that you're teaching them that they're a little bit shocked that there's such adversity out there for that group?
They're very shocked.
Yeah.
This is not something that is necessarily well known.
Or they think the opposite, that their life is actually easy in a certain way.
Yeah. And
I've heard people say those types of things too.
Yeah. And what I can share is even in this program, when we were just winding up in May and I was sharing the status of these legislative bills, there were people who were in the room that were crying because they didn't realize this was going on in our country. And so that just tells you how hidden this is from the media coverage, or how little it is, the true impact of what is going on is shared with the public.
Mm-hmm. Yeah, the amount of people don't realize the amount of suffering that has been covered up, so to speak, in these communities.
Yeah, and the intersections. If you're a Black transgender female in today's society, we just had what looks like to be at least the 25th death yesterday, and I mean it's a real crisis. We want to talk about intersections and compounding identities and disparities. Intersectionality needs to be at the top. Yeah.
Has the APTA done enough, the American Physical Therapy Association? I mean, they can't do everything, but I'm wondering if they should have, stepped up to the plate a little bit sooner on topics such as this, because, there are things like House of Delegate statements and positions that they can make on certain topics.
Yeah, I mean, currently there's a very robust conversation going on the House of Delegates thread right now around an anti-discrimination motion. I actually just posted a personal statement, Sunday, on this topic area, and talking about really trying to frame the conversation back to impact on these communities, and why this conversation needs to continue, and bringing it back to our core values in our profession, right? So we talk about social responsibility. We talk about caring, compassion. We talk about, caring for others and altruism, all of those things. Well, if we're really living our core values, which we all really like to put out on social media that are very important to us, well, then that needs to be put to action. And it's interesting because I bring up this concept of social justice instead of social responsibility, organizational social justice, because that concept moves us from a passive approach of social responsibility saying, yep, I agree with that, I agree with that, I agree with that, and not really, there's no obligation to act, there's no obligation to put that effort forward, whereas social justice really really aligns with and requires us to align our internal behaviors with our external behaviors and our core values, right? And so that's what that framework does. And I really think that we as professionals need to be living through that framework rather than just social responsibility.
Social justice. So when you say that, I think that fits really well with the association's mission around improving society.
Absolutely.
Like the top line is just that, right? We improve society in some way. So how can we improve society if these types of groups don't have equitable means in the United States?
Yeah, absolutely.
Yeah. What would you like to see happen in DPT education? I mean, you're so close to DPT education, both with being a full-time professor as well as, having a PhD in population health. What do you think? What would be a significant step for you to see happen in the next year?
Yeah, in the next year, gosh. Well, in 2019, I actually published a journal article on part of the solution to addressing, some of the disparities that exist in these communities, and that is inclusive education. And I put out kind of a roadmap for rehab professional education, so OTPT, with an outline that matches the American Medical Association's publication in this area, and just reframed some of their domains of education to our domains of education. And so we really need to be making sure our educators are inclusive in their teaching practices, and then 2, in their teaching content. And so, that what that looks like is everybody just, make sure that the case studies that we use and the patients we're talking about represent the society that we live in, right? And it's not all this generic 83-year-old female, yada, yada. Doesn't have a race, doesn't have a sexual orientation, doesn't have a gender identity. We don't know what the pronouns are, or you said female, so we assumed the pronouns were she, her, but we didn't go through the process of really being patient-centered about not making that assumption. And what do we do when we read that case, right? So again, some of this stuff is actually on the shoulders of our educators first. And that's why we put this faculty development program together. And we're really excited. I just wanted to mention we're looking for ways to open up the faculty development program beyond Jefferson this next year. And so hopefully we're going to be able to do that, because it doesn't really exist anywhere else in the country. There's various workshops you can go to, but nothing like this. And so what I would like to see happen in our professional education is that people actually take a DEI lens to their own classes. So even if our association creates a checklist of how to be inclusive, how to pour through when you're revamping your course, here's the checklist. You need to make sure your syllabi is gender neutral. You also need to make sure that you're not making assumptions about your students in your class. How do you set up a brave conversation so students can speak out? Are you actually asking? Are you being equitable in your classroom to begin with? Are you asking certain people more questions than others? Are you asking the same level of types of like all of that bias stuff that happens with us because of who we are? We need to take a deeper dive as educators because we're the responsible parties, right? So I really want to see, I think, that education takes an accountability check to its educators first in this area.
This will be a more difficult and unpleasant question probably for people to think about, but do we have any evidence that there's some built-in discrimination in PT programs, knowing that there's some built-in discrimination in our society? Some of that may have actually trickled into the university mission or university education, then maybe eventually into a DPT program. So you might have LGBTQ individuals in programs right now that are up against some significant adversity.
Absolutely. And some of our research, so our second stage of the research study I was talking about, that's we talked to clinicians first, is we're talking to faculty and students. And what we're finding out in the middle of this going on right now are exactly some of the things that you just referred to. Is there are some staggering things going on in our programs that get pushed aside, get put under the table, get ignored, and not dealt with in a very inclusive way at all.
Mm-hmm.
Yeah.
Which is why I know you and your colleagues started the whole Pride initiative within the association.
Oh, PT Proud, yeah.
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 So there's a place for people to find like-minded individuals and to have a place to go, right?
Absolutely. And PT Proud's, again, this past 6 months has really expounded. We have very active task forces now, and we have quarterly member meetings, and every time there's more people there. So it's really nice to see.
Yeah. Have you had the opportunity to mentor any SPTs, or student physical therapists, who reach out to you and said, "Hey, I'm having some challenges and I'm glad you're here and you're producing some information around this"?
Yeah, actually, I would say that several of us in the leadership of PT Proud probably interact almost on a weekly basis with students from across the country. Yeah. in various ways. So it's very clear that there is a gap, that these students don't feel like they have someone in the program that they're in to talk to, and they reach out to us. Yeah.
Yeah. You're all fast becoming mentors. I mean, it's been just 2 years, right?
Well, PT Proud has been around since 2018. Yeah. Yep.
And where can people go to find information about PT Proud?
Yeah. So HPA, we are hosted under the Global Health SIG in the section Health Policy Administration, which is going to be a new name very soon. But you can go to ptproud.org. That's our website. You can also find us on Facebook. We also are on Twitter, although that has not been as active, but it's going to get active again. So when you look us up, there are either on Facebook, you can put in a request for information or to be contacted if you want to get involved, or on HPA, or ptproud.org. There's also a contact us button that you can add your information into, and we'll get back to you.
Excellent. I know you're going to be finishing up your PhD soon, so we're all behind you and rooting for you to finish up strong, right?
Yes, not soon enough.
In the interim, how can people learn more about you and stay in touch?
Oh, yeah, thank you. People can find me at Thomas Jefferson University. Just Google me, physical therapy department. You can email me at karla.bell@jefferson.edu. And that's how folks can find me.
Great. And then you also have a Twitter handle too, right?
I do, at Passionate PT.
Great. So that Twitter handle is at Passionate PT. And we're going to link to her website at Thomas and Jefferson University, and the PT Pride information. All that can be found on the show notes at the Integrative Pain Science Institute. And if you are an educator in a DPT program or any other healthcare program, or a PT or another health professional, make sure that you have this information out with your colleagues so they can learn more about equity in the United States for these types of populations. I want to thank Karla for being with me for this special edition, and we'll see you next time.
Thank you so much.
Thank you for listening to the Healing Pain Podcast with Dr. Joe Tatta. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's Integrative Pain Science Institute.com. Sign up to receive weekly updates, leave a review on iTunes, and share this episode with your friends.